Welcome to Alzheimer's Breakthrough with Dr. Josh. I'm your host, Dr. Josh Hellman, a Harvard-trained physician, biochemist, and lifelong advocate for making aging and dementia optional. Today, we're diving into something that most people have never even heard of, a powerful class of nutrients called polysaccharides that could hold keys to improving brain function, immune balance, and even quality of life in patients with Alzheimer's and other chronic diseases. And joining me is someone who has dedicated his career to proving this scientifically, Dr. John Lewis, PhD. Dr. John Lewis is the founder and president of Dr. Lewis Nutrition and a voluntary associate professor at the University of Miami Miller School of Medicine. He's been principal investigator on more than 30 studies, raising over $23 million in research funding and publishing 180 plus peer-reviewed papers in some of the world's top journals. His groundbreaking Alzheimer's study, published in the Journal of Alzheimer's Disease, demonstrated remarkable cognitive improvements in moderate to severe Alzheimer's patients using a dietary supplement based on special polysaccharides from aloe vera and rice bran. That research inspired his now famous TEDx Miami talk and his pivot from academia into a mission-driven business developing clinically proven nutritional solutions. Dr. Lewis has also eaten a whole food plant-based diet for over 27 years and is passionate about using science and lifestyle to enhance human potential. John Lewis, thank you so much for joining and be willing to be interviewed today.
Dr. Hellman, thank you for having me. It's my pleasure to be here. I look forward to our conversation today.
Awesome. And I feel like I almost have to include a trigger warning just because we're going to be talking about glycobiology, which is super complicated to the point where I go to conferences and there'll be basically 50 lectures on relatively simple things like DNA methylation. But when we talk about polysaccharides and specifically the field of glycobiology, most researchers are afraid, even in 2025, to venture into this field because it is so complicated and complex, but you're not afraid at all. So I'm just curious, how did you end up willing to pick one of the most complicated parts of biology that we know of?
Well, I have to give that credit to two people who introduced me to their life stories around 20 years ago. Dr. Reg McDaniel, a pathologist by training who ended up leaving pathology and practicing nutrition based on his experiences with aloe polysaccharides. And then a lady, Reg is in the Dallas, Texas area, by the way. And then a lady, Barbara Kimley, who was a cancer patient at the University of Miami, who contacted me about her story. And this was a rice bran polysaccharide story. And it was fascinating how both of these two people came into my life around the same time. Barbara in the Fort Lauderdale area, Reg from the Dallas area. They didn't know each other, but yet they had these two very interesting stories that just were so fascinating and so just like almost revolutionary, you might say. I mean, when you hear the word polysaccharide, first of all, that's a synonym for what? A complex sugar, a complex carbohydrate, a complex saccharide. And you know as well as I do, we have all of these talking heads running around the world today saying, oh, sugar is bad for you. Like, I don't know about you, but every time I hear one of those guys say that, it makes my skin crawl. Like it.
Same here.
Nuts. It drives me nuts when I say that, because all sugars are not created equally. And so if you're talking about these complex polysaccharides from the two you just mentioned, aloe vera and rice, those are extremely different from something like high fructose corn syrup that I would agree with those people those are the types of sugars you probably don't want to be consuming too much of. So, but yet, it all just gets kind of thrown in together, and you throw the baby out with the bathwater, and then you have all these unsuspecting people out there who get confused by all this information, and they think, oh, well, every sugar is a sugar. No, it's not. It's very, very different. And so I really owe this journey to meeting Reg and Barbara almost 20 years ago, and it led to focusing on running clinical trials with these two sugars and just blowing me away. I mean, my goodness, the work that my colleagues and I have been able to do, and some of the findings that we've made, and especially with your interest in brain health and dementia, we'll talk about that, but it just has been an incredible journey. And so I kind of position myself as like the sugar busting myth man, like the guy out there trying to help people understand, hey, guess what? Sugars are not bad for you. It depends on the sugar. It depends on the biochemical structure and the source. Those, to me, are the two most important characteristics. So that's just kind of a little synopsis of how I got into all this and where I continue to go.
Right. And was this before or after or during you did your PhD at the University of Miami?
That's a great question. And thank you for asking me that, because I didn't mention that. So this was well after my training was over. I mean, I was already at the University of Miami as a professor, conducting clinical trials in nutrition, dietary supplements, and exercise. And I really had no appreciation for polysaccharides. I mean, I may have had, a couple of lectures in biochemistry in grad school about saccharides in general, but the idea of, their unique characteristics and their unique just ability to have such profound health promoting benefit, I had no clue. And that wasn't any fault of my professors per se. It was just that they probably didn't know either. I mean, there wasn't, as you mentioned, glycobiology, that the field or the science of glycobiology wasn't something that was anything that I had focused on in my training. So this was, I finished all my training. I have this interest, generally speaking, in health and wellness and nutrition and exercise. But then years later, these two folks come into my life and they tell me about sugars from aloe vera and rice bran. I'm like, what? Like, what? Like, what is that? What are you talking about? Like, so it was like totally like, just like such an eye-opening experience. And I don't know about you, but I've always been the kind of person, my personality is such that I take everybody at face value. Like I don't like to be skeptical of people by nature. If somebody tells me, hey, this is my story or this is what I do or whatever, I believe you. Like that's just my nature. And so, and I'm also the kind of person who's a bit like a chameleon. Like I can sort of, meld or mold to whatever the current environment or setting is. If it feels right to me, then I decide how much of that I want to take into my own sort of journey, if you will. And that's exactly what happened with Dr. McDaniel and Barbara. They had such compelling stories that I wanted to learn more. And then it just kept growing from there.
Fascinating. So this raises so many issues and questions, but one is basically the whole science of polysaccharides. I mean, I agree with you. Guess what? Sugars, carbohydrates, polysaccharides are a necessary component of life, both for plants and people and everything that's alive. So to say that somehow carbohydrates are bad for you, it's like saying water's bad for you. Yeah, guess what? You can drown, but
right.
I mean it's like
yeah, no, it's just so preposterous, isn't it? Like this whole movement of I guess it started out almost 50 or about 50 years ago with Robert Atkins. I guess he's kind of the originator of that whole movement of, low carb to no carb and all about meat and dairy and fat and protein. And then it morphed over the years into keto, paleo, now carnivore. I mean, it's all kind of the same. It's just different names, different marketing strategies, if you will. But the idea that carbohydrates are bad for us, it's just preposterous. Like you said, I mean, our life is built around it. I mean, why would our blood be measured in glucose if we only should be eating protein and fat? That's ridiculous. Besides oxygen, our next fuel source is carbohydrate.
Right. And it's not just a fuel source. What I love now is we're understanding that within the normal mechanism, the biochemistry of the cell, different sugars, different polysaccharides are actually used as signaling molecules.
That's right.
And we don't even understand all of them. It is so complicated. And unfortunately, there aren't many researchers in this field. I think maybe in 10, 20, 30 years, we'll know a lot. But today, a lot of it's still a black box. So talking of black boxes, do you, from your studies, you're studying what when people take in these polysaccharides, but do we have any idea if you're eating these different polysaccharides, what impact that has on the polysaccharides or the glycobiology actually within our brain or inside our cells?
Well, so I can tell you based on our research, I mean, this is a bit, of a biased view, if you will, because it's our own research. But when you look at the entire body of our research, you hit the nail on the head. These nutrients are signaling mechanisms to the immune system. They, in some way, and I think it's even maybe beyond biochemistry. I think it's maybe even at the physics level. There's got to be something very special and unique about these particular polysaccharides from aloe vera and rice bran that we've studied. I don't claim to know everything about, all the different mushrooms, the seaweeds, even grains, more common grains and vegetables. All of those plants have some level of polysaccharide content. But what we've particularly looked at, again, is these sugars from aloe vera and rice bran. And so just, kind of overall, what we've shown is this incredible immunomodulatory activity. What does that mean? Well, on the one hand, you're talking about increased immune activation. You're talking about better overall immune function. You're talking about lowering chronic inflammation. You're talking about boosting adult stem cell production. You're talking about decreasing infections. You're talking about balancing the pro to the anti-inflammatory ratio of the immune system. You're talking about turning on the natural killer cell cytotoxicity. I mean, need I go on and on? I mean, it's incredible what these polysaccharides do that we've published scientific data that we've published from our lab. That's not opinion. Again, it's a biased view because it's our work, it's our research. But again, just looking at our body of research, I mean, I would put it up at anything else out there. You're not going to see this type of research from protein, from fat, from a carnivore, whatever that means, diet, paleo, keto. You're not going to see that. Those results don't happen when you consume protein and fat. They don't. I'm not aware of it. If there's a listener of your program who knows research about that type of thing, I would love to be educated about it because I have yet to see it.
Got it. And just to be clear, the two different types of polysaccharides, the ones from rice and the ones from aloe, they're different. They have a different types of polysaccharides.
They are. They're different.
And I guess what you're doing is you're combining the two of them in your products?
Right. Correct.
Okay.
What's fascinating, kind of going back to the original point about a sugar is not a sugar. If you look at a monosaccharide, one saccharide, one sugar, like high fructose corn syrup, then you have disaccharides, two molecules of sugar like sucrose. Then you have oligosaccharides like the sugars in breast milk. Those are maybe 10 units of glucose. And then you have these guys that we're talking about. They literally can be thousands of glucose units attached together by these glycosidic bonds. So they are literally like 5D structures. You cannot even draw these things on a piece of paper. So when you have all of that complexity in that structure, that to me, I mean, Dr. McDaniel and I have talked about this a million times over the years. That to us is why when the genes interpret all of that information, and remember, folks, these are way more sophisticated and complex than your amino acids, than your fatty acids. You're talking about all of that coded information in like a library that the genes interpret that information. And to your point about the cellular, the functioning within like the Golgi and the endoplasmic reticulum, that's where the genes then guide our cells to function properly. And they take those units of those polysaccharides and they attach them all together, and then they create some sort of bioactive compound like a glycoprotein or a glycolipid or a cytokine or a growth factor, or they communicate with another cell. It's just fascinating. I mean, this stuff is mind-blowing.
And let me ask you kind of an analogy. So if I have you ingest a very large protein like collagen, the reality is most of that collagen, if you swallow it, is not going to get absorbed because it is so big. Is the same true with a polysaccharide that has, say, 1,000 different linked sugars together?
That's a great question. So I think what happens is, you got within these saccharides, you've got this prebiotic, biotic, postbiotic type of architecture as well. So there's definitely something going on. That's a bit outside of like the gut component of this. That's a bit outside of, we've really focused most of our research on the immune side, but that's a great question. I mean, I'd like to better understand that. And maybe in some of our future research, when I say when, not if we get the funding to do it, that we could look at some of those connections between the microbiome and what's going on with how those saccharides are actually having that type of an effect. I would love to know. I'd love to give you a good answer, but I don't really know. That's a great question.
Awesome. So for right now, in some ways, it's a black box, but it makes sense that if you're taking in a large molecule, it could have an effect on your microbiome. And like you said, prebiotic, biotic, and postbiotic. Wow. So it's so complicated. But just to be clear, it's not the case that you're taking in these polysaccharides and then they're magically getting transported to your brain and fixing something in a linear. This is a much more complicated it's probably 5 or 7 layers of
That's right.
Of
And
effect.
again, going back to your statement, your point, which I totally agree with, is it signals the immune system to do something, whether it's to reduce, the pro-inflammatory side or to elevate the anti-inflammatory side or vice versa, or turn on natural killer cells, turn on dendritic cells, turn on, helper cells, shut down cytotoxic cells. I mean, there are just so many things going on there, but it's clearly overall like a net benefit of better or enhanced or more surveillant immune system functioning.
And that's what we're seeing in many neurologic conditions, dementias, including Alzheimer's, that inflammation is one of the common root causes causing the dementia or the Alzheimer's to progress. So it makes sense if you can take a supplement that is going to somehow modify your immune system and turn down the inflammation, it makes sense that you potentially could see a better result with something like that.
That kind of leads me to the result of our Alzheimer's study. In the first paper that we published out of 4 from that study, we showed reductions in TNF alpha and VEGF. And I think our paper was actually the first paper that ever showed that in people with moderate to severe Alzheimer's disease. That paper was published in the Journal of Alzheimer's Disease back in 2013. I'm not aware of any other paper that showed that in people with Alzheimer's. Of course, those are classically looked at in cancer and heart disease, but I'm pretty sure our paper was the only one that even maybe today, I mean, I haven't specifically done that type of literature search in a while, but I think even today that paper is still the only paper that shows that type of change in TNF alpha and VEGF in response to a dietary supplement in people with moderate to severe Alzheimer's disease.
Fair enough. And what do you recommend in terms of, should you take this supplement on its own? Should you take it with food? What are your thoughts there?
That's a great question. So I think generally speaking, and of course, this isn't the pharmacological model, right? This is the nutritional model. I mean, our product that we now call Daily Brain Care is a whole food complex. It's not just like taking, I don't know, say magnesium or selenium or vitamin C. It's a complex of literally thousands of different dietary factors. And so I mean, this is a supposition. Probably if you took it with food, it might absorb a bit better. I don't have any data to support that. I'll tell you my personal use is in the morning. I have most of the supplements that I take in the morning, and that's of course on an empty stomach. But then later in the evening, I take my second dose of Daily Brain Care, and that's usually 2 doses a day. Although some days if I'm feeling, maybe I'm starting to come down with something or just, overworked, stressed out, whatever, man, I'll take it like throughout the day. I'll take 4 or 5 doses if I want to. I mean, there's no downside to taking too much. But so I'm doing it kind of mixed. I'm taking my initial dose during the morning or early afternoon on an empty stomach, and then I'm taking my second dose after dinner.
Got it. And I noticed that your product, you have some are in capsule form and some are actually in a powder form. How do you take the powder? Would you just mix with water? What?
I'm a bit of a caveman.
Okay.
I just scoop it straight into my mouth.
Okay.
I know that's not typical consumer behavior. But so what I recommend for people to do is, with water or their favorite juice of some sort, it mixes great with smoothies, yogurt, applesauce, oatmeal, cereal, soup. You literally can put Daily Brain Care in anything. It's got a very pleasant taste. So it's not offensive at all. I mean, of course, certain percentage of the population will not like the taste or the texture. That's why we encapsulate it as well. But it mixes well with everything. Really, the only thing I tell people not to do is, and we do have a few people that like putting it in their coffee, just let the water temperature cool down a bit. You don't want to damage any of the nutrition with something that's really hot. But other than that, you can basically mix it with anything. It literally is that easily mixable. But it's thick. It's thick because of the rice bran, the flaxseed, the sunflower lecithin. It's a thick material. It's not like a little, like very fine, like something like a magnesium. You pop a capsule of magnesium and it's very fine. It's not like that at all. It's a very thick powder.
Interesting. So for some of my patients, what's interesting is that they may have, they've got GI, gastrointestinal absorption issues. They may have mold or for some reason they can't absorb through their gut. So for those types of people, it sounds like maybe the powder, your caveman approach, might be the right approach because they may actually be able to absorb it through their mouth, but not lower down in their gut.
That's exactly right. And in fact, so I don't just try to swallow it immediately. I put it in there and then I allow a little bit of saliva to kind of build up with it and kind of chew it and then swallow it that way. So you are getting that good like mucous membrane potential there. But it's interesting, kind of going back to your earlier question about what's going on at the gut level. We've actually had, and don't be misled by the name Daily Brain Care. I mean, it's certainly, as you know, the body doesn't care what the name on a label is. It's what you're giving it. We actually get a lot of people with different gut issues that respond very favorably to Daily Brain Care. In fact, one lady, I'll always remember her issue. She was in her, I want to say mid-30s, and had told me basically her entire adult life she had constipation, and she was getting ready to spend like this big $2,000 workup with somebody to try to help her fix her gut at the time that she and I met. And I said, well, try Daily Brain Care. You've got nothing to lose. It might actually start helping you. Literally within less than a week, she called me up one day and she said, John, I'm pooping like a champ now. I can't believe it. Like it's completely changed my bowel habit. And so she was able to save that $2,000 and been straight ever since. So it's interesting how, and as you know, as a physician, the so-called, second brain in the gut, I mean, that combination of everything going on there from digestion and all the way to central nervous system function. And then what happens with, gut function when you provide it with these polysaccharides plus some of the other nutrients, it can be very powerful for people.
So John, tell us about the different ingredients, because we're talking about primarily two types of fiber, but you've got many different ingredients in your product. And you were saying that for people who are eating large amounts of fiber in their diet, not many people, or at least, are getting the aloe vera part. But share with us why you have so many different components in your product, but beyond the two different types of fiber.
No one that I'm aware of eats aloe vera, and that's why Daily Brain Care can be special for somebody even eating a whole food plant-based diet where you're getting 70, 80, 100 grams of fiber every day, and you're getting that well beyond the recommendation, but you're still not getting the polysaccharides from the aloe vera that, in my opinion, are just so important and so potentially beneficial for all of us. And remember, we don't have to wait till we end up with neurodegeneration or heart disease or cancer or diabetes. Why not let's try to prevent that stuff in the first place? And so let's do that with these polysaccharides. So that to me is why even somebody eating a really great diet can still benefit from daily brain care, because of the uniqueness of this formulation. And then to your very good question about the other ingredients in daily brain care. So for example, there's something in there called Dioscorea. It's a very unique wild yam. It's a Mexican wild yam that, again, the average American wouldn't be consuming that stuff, but it's got very unique nutrients, phytonutrients in it that help us to regulate our endocrine system. So that's obviously very important. As you know, as a physician, we've got all these people running around today with so many hormonal issues. And so helping somebody that maybe has, a thyroid issue or a pituitary gland issue, some other endocrine system issue, to help with that, then you have something like the wild yam in there. The tart cherry, wow, what another nutritional powerhouse that thing is. I mean, it is loaded with all kinds of nutrients. It's a natural source of melatonin. We have, 100 million Americans that either have insomnia or problematic sleeping. So you take your daily brain care, a lot of people report that they sleep better with our formula. So again, it could be partially at least due to the tart cherry. Sunflower lecithin, it's a great source of choline. Choline is one of those other very unique nutrients. It's not a vitamin. It gets lumped in with the vitamin B complex in a lot of different formulas, but choline is obviously very important as a precursor to acetylcholine, maybe arguably the most important neurotransmitter for the brain's functioning. So again, it's a source of that. The flaxseed, that's interesting. A lot of times people think of flaxseed as very good for omega-3, and that's true. I'm absolutely not debating that. But what they don't know about flaxseed is that it is the most, I think by volume, this is a true statement, a factual statement. It has the highest source of lignin content in it of any other plant in the plant kingdom. What do lignins do? They knock the crap out of cancer cells. I'm not claiming, and this is maybe a good point to say this, because you and we're kind of teetering around that edge of talking about health versus disease. Let me please be clear, and I always make this statement every time I talk to people publicly. I never talk about using nutrition to treat disease. That is the pharmacological model. I remain in the nutritional world. The nutritional model says you provide the raw materials that the body needs, guided by the genes, to enable our cells to function properly. If you have some sort of health challenge, hopefully that helps your body through these signaling components and these signaling mechanisms to return to homeostasis. But I never make any disease claims about the work that I do. It's always about providing function, structure, opportunity for the cells to work properly. So again, I'm not saying if you have cancer, take daily brain care and these lignins will knock out your cancer. I'm not saying that. But what we know is that through the study of these lignins, they are very anti-carcinogenic. Same thing with IP6. IP6 is actually an acetyl hexaphosphate. It is also a derivative of rice bran. It also has very potent anti-carcinogenic components to it. Again, I'm not saying it treats cancer, but it helps you to regulate your natural killer cells and your dendritic cells and your macrophage and all of these other components to the immune system that are looking out for you and helping you to hopefully not get cancer. Citric acid, it's a very important molecule for the Krebs cycle. What is that? The Krebs cycle is the cycle that all of our cells use to generate cellular energy through the mitochondria. What am I leaving out? We touched on the polysaccharides. I know, NAC. This is a very important molecule that's a precursor to glutathione, one of our most important antioxidants. So NAC, that's something that's looked at for, people that have toxicity from too much acetaminophen or some other type of heavy metal or carcinogenic exposure. You use NAC to help the body detoxify and get that material out of the body. Another one that I'm forgetting, a very, very important component to this, the Ultra Terra clay. This clay comes from a very deep water lake in Mississippi. This clay is loaded. It's a type of fulvic humic acid type material. It is loaded with all of the essential minerals, but it also is a very potent chelator. So it binds to all these different types of, PABs, PCAs, PAHs, all these other things. This we're getting bombarded now with all this information about all these microplastics that we're all walking around, carrying around in our body. So it helps all of these heavy metals and all these plastics and all these other carcinogenic materials to get chelated out of our body. So as it's helping the body, it's supporting the cellular structure with its mineral content. It also has this very unique chelating capacity to help pull out all of that stuff out of the body. So it's just a broad range of nutritional support that we looked at initially in our Alzheimer's and MS studies as a way to support these folks due to their neurodegeneration and all their other related comorbid issues. We were not looking for a magic bullet. We could have just studied just the aloe polysaccharide, but we really were setting this trial up not to kind of, fall into this thinking of, everybody's looking for the magic bullet, right? Like,
right.
I bet if not all, most of your patients are saying, Dr. Hellman, tell me that one thing to do, right? Like they want that one thing that's going to be this magic bullet to,
of course,
get them over the hump. And that was not what we were interested in doing. We wanted to provide all these different materials to the cells at the same time to, again, kick in this process of restoration, healing, homeostasis, the body's own inherent intelligence that it has to be able to do that. And that's the reason for this formula that is now just helping untold numbers of people.
And let me ask you this, because one of the components you just mentioned is a binding agent. I normally tell my patients to take binding agents separately because I worry, great, you've got a binding agent, the fulvic acid, etc., but isn't that going to bind some of the components that in your formula?
It's certainly possible. I mean, it's not a huge by volume or by, percentage of the mass of the formula. It's not a huge component. So there's probably a bit of that going on, but, again, trying to be like efficient and functional for the average consumer. This was just kind of, not really a one size fits all formula, but a formula that, I mean, again, in the context of, and this with your patients, you have this poor patient dealing with neurodegeneration, and then you've got the caregiver who's also under so much stress and strain and dealing with not only the loved one's health status or lack thereof, but also the caregiver's health status or lack thereof. And so trying to make a formula that kind of allows that convenience, but also efficacy at the same time was part of, what went into the design of this formula.
That makes sense. So, do you find when people start taking it, they get a change in bowel habits, either diarrhea or constipation?
So I can tell you now at almost 20 years with, using this formula, either in research or anecdotally, I can probably count on literally one hand the number of people who have had that level of a negative GI interaction. I mean, you will occasionally get somebody that says, oh, wow, I started like pooping too much. Not necessarily diarrhea, but maybe a bit of a loose stool or something. And so that person, to me, probably has like a very sensitive constitution. And I tell that person, that's not an adverse effect. That's actually showing you that our product works. What that means, though, is that you need to dial down the dose and then just very slowly work it up to like the level where we would have, for the same level that we would have used in the clinical trials. That, to me, is actually a good sign. I can't recall anybody off the top of my head that reported constipation, but I can tell you a few people that's, had like this sort of, if you want to call it a Herxheimer reaction or some kind of like rapid detox effect. And so I have to tell them to, cut it down and then slowly work their way back up.
Got it. And so what would a normal starting dose be for your product?
Well, for most people, so in the Alzheimer's clinical trial, we used 4 scoops of the powder per day. The capsules, so three capsules equal roughly 1 scoop of the powder. I tell usually just about anybody who's at either middle age or older, not even counting, how many health challenges or issues they're dealing with, try at least 2 scoops of the powder per day. So that would be 6 capsules equivalent. Do one in the morning and do one in the evening. If they're super sensitive, like the rare person who, is just going to have this rapid detox reaction, then I say do 1 scoop per day and then do that for like a couple of weeks and then try to introduce another scoop. But I don't think most, unfortunately, as you know, most Americans now are on at least 1 or 2 medications. They're dealing with something like hypertension or diabetes or, something on the way to overt heart disease or cancer. So for those folks, I say start out with 2 scoops per day. See if you notice an effect. Give it at least 30 days, if not 60 to 90. Again, people are in this, rapid, they have to have some kind of meaningful response like that, or they think it's not working. But as you know, cellular turnover takes some time. Healing takes some time. You didn't become diabetic overnight. So why in the world would you expect, nutritional changes or modifications to suddenly get you out of diabetes or whatever? But at least, that 30-day window to say, okay, what's going on here? And then a lot of times the things that people will notice initially are, as I've already mentioned, like better sleep, better bowel habits or movements. You will notice more clarity, more focus, better energy. I've seen a lot of people have a very significant change in their skin tone. So there could be all sorts of different effects that they will experience. And then maybe some of those other effects related to neurodegeneration, cognitive function, pain, anything more severe. It may take a bit more time, but there are definitely what I've also noticed over my now almost 20 years at this is I'm lumping people essentially into 3 different categories. You've got about 20% of people I refer to as super responders. Those are the folks that will literally tell me within a couple of days, wow, I can't believe how much better I feel. Those are definitely the super responders, about 20% of people. The vast majority, around 60%, they're going to take 30 to 60 days. But again, they kind of, they'll start noticing those things. And then there's that other 20% that may take 90 days or longer. And then, sometimes it's difficult with trying to advise people or coach people to just continue to be patient. Even if you, on the conscious level, are not noticing something yet, just know that there are things going on at the cellular level that may not be getting all the way up to your conscious yet that are happening for you that are beneficial. And, fortunately, most people can be convinced if they're at least open-minded, but, there's still a segment of people out there that just, there's so much in the instant gratification, they just won't listen. But again, those are roughly the 3 general categories of people that I've sort of lumped people in as over my experience with this now.
That makes sense. And going back for a second to the ingredients, you mentioned citric acid. I know some of the listeners are concerned that, at least commercially, one of the common sources for citric acid in supplements or products turns out to be mold.
Right.
And if someone's already sensitive to mold, they don't. What do you know the source of the citric acid in your product?
Yes, absolutely. Ours is definitely not mold.
Okay.
We also have vanilla in our formula as well, and that comes from some kinds of vanilla. It comes from a beaver anal gland or something. I mean, some bizarre. Right. I don't remember exactly what animal's anal gland that is, but it's some bizarre source of that. So yes, I mean our citric acid comes from lemons, limes, oranges, that type of citrus fruit. So
fruits. Okay.
Yes, we're plant-based. I mean, we're not, unfortunately, we're not certified organic. A couple of the ingredients are certified organic, but we're non-GMO, plant-based, non-synthetic. We try to hit as many of those thresholds as we can in terms of good, clean ingredients. And I certainly, I've been on my own formula for over a decade now. I've had my mother on it for about, mom's been on it maybe 13, 14 years. When my wife was pregnant with our children, she was taking it. Our children, when they both turned 5, 6 months of age, they started taking it. So, this is literally, cradle to grave, and all of us in between, and even pregnant women who can take this and And so I would never sell anything that I wouldn't be taking myself, or that I also wouldn't stand behind in terms of, good, clean ingredients.
That's awesome. And then you mentioned beaver extreme. That's not your product. Just to
No,
just to
no.
clarify. Okay, good.
Ours is the natural vanilla. It's not the beaver anal gland or whatever poor
Right.
animal that
Well,
is.
you say natural. I mean, you can make a synthetic from petroleum vanillin, but it sounds like you're not using petroleum, right?
We're
Okay.
using the real vanilla plant.
Okay, just checking.
Yeah.
All right, and
Yeah.
it's a shame. It's a shame you have to do that, but unfortunately, as a consumer, you can't just assume. And do you recommend that people take this every day? Pulse go on, go off it. What's your been experience with that?
Again, for me, this is like breathing and drinking water. I mean, we need these nutrients every single day. We want our cells to be optimally functional every single day. So like I mentioned, I mean, my whole family, we've been on it for now many, many years, especially my mother and me. And so I don't look at it as like, cycling on and off like you would maybe, I don't know, hormone therapy or something. I mean, certainly if you were into competitive bodybuilding and taking steroids, those guys cycle on and off steroids. But I look at this as just as important as any other vitamin or mineral that you would take every day, even though, as you know, these polysaccharides are not essential by definition, but you're not getting them from, the diet. So you need these every day to help keep your system, your body regulated properly.
Yeah, and you were talking about lignans. I remember like reading about Gandhi like 100 years ago was promoting flax seeds and lignans
Yes.
as a way to improve health and avoid chronic diseases. Again, we're not making any claims here, but
Right.
this is not a new idea that plants
Right.
can actually help people's health. And you've been plant-based for what, 27 years?
7 years now. Yes.
But you don't have to be plant-based to take the supplement, right?
That's right. Well, I'm glad you said that too, because we kind of poked a little bit of fun at the carnivore paleo keto crowd a moment ago. But, for those of you who eat that way, and, I beg your forgiveness for not agreeing with your dietary strategy, but don't be so, blinded by the forest for the trees to think that, oh my gosh, this guy's promoting a plant-based product. It can't possibly be good for us. No, again, I will stand by the statement. You will not see these types of immunomodulatory effects from taking protein or fat from an animal food source. The research is not there to support it. And you don't even need that much. I mean, I don't know what the average American eats today in terms of macronutrition. Is it 3,000, 3,500 calories per day? Whatever the number is. With daily brain care, you're only talking about a couple of grams, maybe a few grams if you have some sort of, more advanced stage of health issue. So you're only talking a few calories. I mean, you're literally in the micronutrient framework. You're talking about a very, very small amount of material compared to everything else that you're consuming throughout the day. So don't be so distracted by just because these nutrients are coming from plants that you think, oh, well, I can't do that. That's going to screw up my ketosis, or, it's going to somehow invalidate my paleo strategy. I mean, please don't be that close-minded.
Right. Yeah. So in your own academic journey, I mean, you got a PhD, professor at University of Miami. Did you end up leaving academia, or what happened there?
I did. And so, with Josh, it's fascinating. I mean, my peak academic accomplishment running this clinical trial in Alzheimer's disease that we barely even scratched on yet in this conversation, it ended up being like the beginning of the end of my academic career. We published this first paper in the Journal of Alzheimer's Disease in 2013. And the most exciting finding, I mean, again, I'm just scratching the surface of this, but we showed clinically and statistically significant improvement in cognitive function at 9 and 12 months in response to our formula in people with moderate to severe Alzheimer's disease. That's like an unheard of discovery. You can look at any kind of diet, any other dietary supplement, exercise, acupuncture, red light therapy, sound therapy, music therapy, cognitive behavioral therapy. You pick it. I mean, I would love for somebody to show me, hey, John, look at this study. Here's something that's similar to what you guys showed, because there's nothing else out there.
The exciting thing is in the last couple of years, we've actually starting to see studies showing the reversal of Alzheimer's using lifestyle. That Dean Ornish published a study last year. This year, you've got the finger study. Now, one component of lifestyle is nutrition, and they're definitely using supplements. I don't think they're using your exact supplement, but I would say you're a trailblazer. I mean, you were doing this, what, over 10 years ago?
That's what I'm saying. Our first paper was published in 13.
Okay.
So you can imagine, I mean, Josh, literally, like, we showed this, we were running, it took us two to 3 years to run the trial. I mean, a 12-month intervention, people this sick. We enrolled 34 people in the study. I mean, it was not an insignificant undertaking. This was a lot of work by a lot of people. We have a pretty extensive author list on our first paper. And so we get the study done. We're, looking at the data. We've entered it. We've double checked it. We've cleaned it. Now we're getting to the stats part. We're looking, and Dr. McDaniel and I were so excited to look at what was on the 8S-Cog, because that is considered to be the gold standard for assessing cognitive function, especially in people with any type of dementia. And oh my goodness, here we show clinically and statistically significant improvement in cognitive function at 9 and 12 months. I mean, I was ready to rip off my shirt and run around the block, when this came up. And it's the only paper in my career. I'm lucky to have had now, 180, 190 papers in my career, even though the last 8 years, I haven't really been focused too much on that. But it's the only paper in my scientific career where we submitted the paper for publication, and Dr. Perry, the editor of the Journal of Alzheimer's Disease, he called me up and he said, wow, Dr. Lewis, your paper's incredible. I'm going to recommend that we publish this paper as soon as I get the reviews back from the reviewer. Like, even he couldn't believe our findings. But what ultimately happened, and I'm sorry for such a long-winded answer to your question, is I immediately started drafting proposals to NIH, to Alzheimer's Association. I thought, man, these people are going to give me more money than I know what to do with. And oh, by the way, the only reason we were able to run the study anyway was because Dr. McDaniel was giving a lecture about his work with Alzheimer's and Parkinson's, and he had a lady of a husband and wife. The wife was in the audience. She heard him talking about this. They had some money. They said, we'd love to donate to your work because what you're doing is very exciting. They'd lost 4 family members to Alzheimer's disease. And so I just happened to be at the right place at the right time, that this family had some money. Reg was not in any type of academic institution. He said, hey, John, we've got an opportunity to run a clinical trial. We just have to do it in Alzheimer's. And so that's the only reason I even had that opportunity. But after 4 attempts, twice with NIH, twice with the Alzheimer's Association, of saying, hey, guys, look, here is a proposal that's not just an idea. We actually have data. I got that much in response.
Wow.
That was the beginning of the end of my academic career. I just didn't even know it at that time. But from 13 to 17, when I left academics full-time over that, roughly 4-year period, and I had a lot of studies going at that time. I mean, it wasn't just my polysaccharide work. I had lots of other things in nutrition and exercise at the same time. But basically, I said, you know what? I'm not going to spend the balance of my life trying to get these so-called experts to acknowledge what we've done here. I've got to move on. And I just took a leap of faith, and I took the results from our work in our research lab, and I turned it into a dietary supplement company. I mean, that's not been a bowl of cherries either, in terms of getting punched in the gut by people and people trying to steal my formula and all kinds of other nasty stuff I've had to deal with. But it is what it is. But I'm grateful for, and don't get me wrong, I'm not bitter about my academic career, because I wouldn't be here where I am today if I hadn't had it. But it's just a shame that it had to end that way. It didn't really end kind of like, going out on your own terms. I basically was forced out. And so, because I wasn't doing pharmacology, I wasn't doing genetics, I wasn't doing some other, politically correct type of social behavioral thing that gets money, because I was in nutrition. Oh gosh, nutrition. Oh, that's, whatever. That's like placebo work or something, like it's so frowned upon. And so, but again, I'm not bitter. It just made me realize that I had to do something else in life. And I still have a voluntary appointment with the university. I still work with some students. We still publish papers here and there. I try to help mentor as many of the next generation of clinicians and scientists as I can, but I couldn't do it anymore. I refused to live the remainder of my life trying to basically beg other people with money to acknowledge what we've done and to give us more money to extend it.
Wow. That's real. I mean, I appreciate that you're willing to share that. That's,
Yes. It was heartbreaking at the time.
Yeah.
It was really heartbreaking, but I got over it, and I came up with a new plan for my life and my journey. And that's where I am today. And this is what I'm going to do till I'm, take my last breath. I mean, this is my conviction, is to educate people about our research and this formula and how it can help people. And that's what I'll do till the day I die.
That's compelling. Can we go back to the study? Because you're right, we kind of danced around it. How many people were in your study? Were there any side effects? And how long did you end up following the patients?
So it was a 12-month intervention of people with moderate to severe Alzheimer's disease. These were people that were diagnosed by the psychiatrist in the clinic. They had to have been diagnosed for at least 1 year, at least to the moderate severity level, if not the severe severity level. And as you know, those are the people Big Pharma has no interest in studying. Those people, they look at those folks as lost causes, basically. So this was not mild cognitive impairment. This was not mild dementia. This was a really sick group of folks. They were on average 79.9 years of age. They didn't just have Alzheimer's. They had diabetes, depression, different forms of heart disease. We enrolled 34 people. We did not use a placebo. We were not interested in that ethical dilemma of, with such a tragic, horrible disease, do you want to put, half the people on a placebo? We didn't want to do that. In fact, we had, and the caregivers acknowledged that. They said, if this had been a possible placebo study, I would not have put my loved one in it because I don't have time. My loved one's dying. I need to try something to help.
So just to be clear, you did not consider like a crossover study.
We just didn't have the money.
Money, okay.
We only had like $150,000. I mean, that may sound like a lot of money, but it's not. When you pay
not for research.
No. When you pay all your staff, when you pay for all the supplies, when you pay the institutional fees, I mean, that money goes like that. This was not a multi-million-dollar budget. We were literally, counting our pennies and nickels and dimes. And so we just didn't. I mean, you're absolutely right. I mean, had we had even 500,000, something like a larger amount of money that we could have used to have a more sophisticated design, we would have been all over it. But we just didn't. We didn't have the financial ability to do that. But as you know, the law of large numbers says if you get statistical significance with 34 subjects, I mean, people ask me this question all the time, and they're like, well, wait a minute, you didn't use a placebo, and you didn't do this, and you didn't do that. I'm like, yeah, but guess what? Our effect size was so big, we didn't need it. If you showed statistical significance with 34 people, getting 100, the law of large numbers only says your statistics it's only going to get better. It's not
right. If it's a large effect, you don't necessarily need thousands of people.
Exactly. So we didn't need that.
And how long did you end up following? Was it just for a year?
Just for the 1 year. Just for the 1 year intervention.
Got it.
And the other interesting feature of our intervention was that we didn't change their medication, of course. We didn't change their diet. We didn't exercise them. We didn't socialize them. They literally did the same thing every day, obviously in the case of an emergency. And we did have a couple of people that, had, I think, a couple of events. But, just your normal day-to-day activity, just keep doing it. The only thing you do is take our formula and, as like the addition to your regular routine. And we drew blood at baseline in 12 months. And then we did the cognitive assessments at baseline, 3, 6, 9, and 12 months. And that was, a very simple design. I mean, again, it took us a long time, and it certainly was intense, but that change, that clinically and statistically change at 9 and 12 months, I mean, again, there's just nothing else like it on the ADAS-Cog in people with moderate to severe Alzheimer's. And then,
Right. Go ahead.
I know, and then I was just going to say, we showed at the cellular level, we showed an improvement in the CD4 to CD8 ratio over that 12-month period. That's your helper cell to your cytotoxic cell ratio. As I mentioned previously, we showed the reductions in TNF-alpha and VEGF. And then the other really cool finding we showed was the increase of just under 300% of the CD14 cells, a marker of adult stem cells. That was a 286% increase over that 12-month period.
Wow, that's incredible because, as you know, the natural course of advanced Alzheimer's is a year later. Most of the patients are going to be much worse.
That's
so
right.
The fact that not only did they not get worse, not only did they not just stay stable, they actually improved.
That's right.
I think that's why the editor was like, "Wait, we need to rush this to publication," because they hadn't at the time had never seen anything like it.
That's right. And I'll give you the best anecdote from the study. This lady was 93. She was the oldest subject in the study. She had been diagnosed for like 11, 12 years. I mean, definitely way beyond the period when, people normally will live with this horrible disease. This poor soul was in a wheelchair and she could not speak at baseline. I mean, basically just like another piece of furniture there in the center. She came in every day for socialization Monday through Friday, but, basically couldn't do anything. We enrolled her again, Dr. Reg and I, we wanted to help every possible person we could. And we wanted the sickest people before, not even to the 3-month assessment. One day before that, she came into the center one day walking, and she called Raphael. I'm getting chill bumps already. It gives me chill bumps every time I tell the story. She called Raphael, one of the clinical coordinators, by his first name. That guy started bawling like a baby. It was so emotionally powerful for him that it drove him to tears. And again, it almost brings me to tears because, it's wonderful to be a scientist and be ethical and spend your money properly and run a study the way you're supposed to and, do it within all the guidelines. But when you actually can help people, man, that's where the rubber really hits the road because, with all due respect to like the basic scientists out there studying cells and tissues and rats, I mean, a lot of that research, unfortunately, never translates to humans. But when you can do research where you really can, have an impact like that, I mean, I had caregivers. Besides that lady, I had other caregivers calling me in tears, telling me their loved one had done something or said something for the first time in like years. Even the psychiatrist, who was like the biggest skeptic in the world, he was like, "Well, John, we don't do nutrition here." He was like, very almost arrogant about it. He was like, "We don't do nutrition here. We do, we study drugs. That's the big thing." Imagine a psychiatrist saying that, right? Like, like, of course you say that. But even he had to admit, like after the first, I don't remember exactly now, but let's say the first handful of subjects were enrolled and then they'd been on the product for a few months. Even he called me one day and he said, "If these people had not been my own patient, I wouldn't have believed it. Like, I can't believe what these people are doing now."
Wow. Have you stayed in contact with anyone from the study? I mean, any of the patients?
That's been so long ago. And I mentioned this fellow Raphael. He left the center. He's now at another hospital in Miami. I occasionally hear from him, and he was very good friends with one of the other caregivers who also worked at the center. I believe, unfortunately, that lady's loved one was, I think, a grandmother or grandfather. I can't remember now. I have to double check. And unfortunately, I think that person did eventually die. But it's, it's like everything else. Everything is just so driven by funding. And if you don't have the ability to like keep things going financially, it's just difficult to maintain those connections. In fact, I'd be surprised. I hope some of those folks are still alive, but I'd be surprised because they were very old, and we're talking 15 years ago, if any of them are even still alive at this point.
Right. And they got the product during the study, but
correct.
Yeah, but
Exactly. They didn't have to pay for it.
but that doesn't mean they continued after the study was over.
That's
So,
right. And these were not,
oof,
these were typically not wealthy people. I mean, these were,
sure.
very modest people. So it's tough, if you don't have the financial resources. And I don't consider our product to be that expensive. I mean, it's basically $1 a dose. It's not like, spending, thousands and thousands of dollars a month on something. It's, in my opinion, it's very cost effective, but even still for some people, I know that could be a challenge.
Right. It's $1 a dose, and the typical person would have what, 2 doses a day or
2 to 4, depending.
2
I
to
mean,
4. Okay.
if you adhered to the Alzheimer's protocol, it'd be 4 a day.
Okay.
And I take 4 a day. I mean, I do my 2 in the morning, and I do my 2 in the evening. And then, like I said, if I'm feeling like I'm a bit stressed out or burned out, I take even more than that.
Wow. So many questions, but I know we've I mean, I feel like I'm going to have you back.
Yes, let's do it again because I
sometime
really
soon. Let me ask you this: how would you summarize? We've covered so many things. How would you summarize what we've shared today?
Number one, I think the biggest takeaway for the average American is there is no magic bullet, right? Like you can take the best product in the world. Like I consider Daily Brain Care at the top of the list. Of course, I'm a biased. I have a biased view of my own work, but you can't, as you cannot supplement your way to good health. So even taking Daily Brain Care and maybe a few other things, you still need to eat well. You still need to take, exercise every day. You need to be hydrated. You need to sleep well. You need to manage your stress. Of course, don't use tobacco. Don't use or limit your amount of alcohol. I mean, we didn't even touch on some of these other things, but in terms of our conversation specifically, I mean, I just look at Daily Brain Care as like such a unique and potentially beneficial tool that you can put in your toolbox to help you prevent bad things from happening to you. And then if you are unfortunately already dealing with something bad, to help hopefully reverse that through the body's own inherent intelligence and its healing mechanisms. And so to me, this is just such an important point. And again, for those of you that are more focused on like, the paleo keto carnivore movement, please don't be so closed-minded that you think that you can't benefit from some of these plant nutrients, because you absolutely can. And all of this is backed by science. I mean, I'm happy you can go to our website, drlewisnutrition.com. You can contact us there. I'm happy to, answer anybody's questions. I'm happy to share this research. I mean, there's nothing, I put my name on the label, for goodness sakes. I'm not trying to be deceptive or slick or a good marketer of, something that's ulterior. I'm trying to help people. I mean, that's the bottom line. I need to make a living, but I'm trying to help people. And that's the most important thing to me from now till my last breath.
Awesome. Is there anything that keeps you optimistic? Any new development that you're maybe aware of that's coming down the pike in the next 6 months to a year, when you go to conferences or things like that?
That's a good question. I mean, at the macro level, I would hope that, with things that the government is trying to do, with RFK coming in as the Secretary of Health and Human Services, trying to make some big changes. And, it's sad for me that people are questioning this man so much. All he's doing is asking questions. He's asking questions and trying to get to the answers. I mean, if people were healthy, if the average American was not obese, was not on 10 medications, was not on, all these vaccines, all these other things that have been done to people, then yeah, you'd say, what's wrong with this guy? America's perfect. We have the healthiest population in the world. We don't. We have arguably the unhealthiest population in the world.
Agreed.
Why in the world do we not want to get to these answers?
Yeah, it's so true. Is there any question I should have asked you but forgot to?
No, not at all. I think for our next conversation, we can, if people out there are curious, I'd love to like kind of take a little bit of a deeper dive into the research and maybe, get into a little bit more of the nuts and bolts there. But otherwise, I've loved our conversation, and I'm happy to have had this time with you to share my story and hopefully help. If it's just one person from this conversation, then that was worth it.
And again, how can people find you? Are you on social media? If they want to reach you directly, what's the best way to find you?
drlewisnutrition.com is our primary website, and then we're on all the typical social media channels under Dr. Lewis Nutrition. Again, we have an email address, a phone number. I'm an open book. If people have questions, we have a huge FAQ section on our website that will answer hopefully 90-something% of the questions people may have. I know people are not really big into reading anymore, but but, but I'm happy to help anybody that needs it and wants it.
Great. Dr. Lewis, thank you for being a pioneer in this field and carrying the torch and being willing to be interviewed today. That was such a great interview. I appreciate it.
Thank you, Dr. Hellman. It's my pleasure to be here with you.
Awesome. Peace and plants.